How to tell if a new mole is benign or malignant. Have you ever noticed a new mole on your skin and wondered if it is something to be concerned about? Understanding how to differentiate between a benign and malignant mole is crucial for your skin health. One of the best ways to assess a new mole is by using the ABCDE Rule. This simple guideline helps you identify potential warning signs. First, consider asymmetry. A benign mole is usually symmetrical, meaning both halves look alike when you draw a line through the center. In contrast, malignant moles often have an asymmetrical shape. Next, look at the border. Benign moles typically have smooth and even borders, while malignant moles may have irregular, scalloped, or notched edges. Color is another important factor. A benign mole usually has a single shade of brown or tan. If you notice multiple colors or uneven color distribution, including shades of black, brown, tan, red, white, or blue, that could be a red flag. Diameter matters too. Benign moles are generally smaller than 6 millimeters, which is about 1/4 of an inch. If a mole is larger than this, especially if it is growing, it may be suspicious. Evolution is the final aspect of the ABCDE Rule. Any change in size, shape, or color, or symptoms like itching, bleeding, or crusting, should prompt you to seek medical advice. Additionally, pay attention to new moles that appear after the age of 40 or any moles that grow rapidly. Moles that become hard, lumpy, dry, scaly, or start to ooze or bleed should also be evaluated by a healthcare professional. Another helpful tip is the ugly duckling sign. This refers to a mole that looks different from your other moles. Such a mole may warrant further investigation. Common moles are usually benign and stable, while dysplastic or atypical moles can be larger and have irregular borders and colors. These atypical moles carry a higher risk of developing into melanoma, but most do not. Most melanomas arise as new moles rather than from existing ones. Therefore, if you notice any of the ABCDE signs or other suspicious features, or if a new mole appears suddenly and changes rapidly, it is essential to consult a healthcare professional. Only a healthcare provider can definitively diagnose a mole as benign or malignant through a clinical examination and, if necessary, a biopsy. Early detection and treatment of malignant moles are critical for the best outcomes. In summary, keep an eye on new moles for asymmetry, irregular borders, color variation, size over 6 millimeters, and any changes over time. Regular skin checks and prompt medical consultation for suspicious moles are vital for skin cancer prevention and maintaining healthy skin. Remember, when in doubt, always reach out to a healthcare professional for personalized advice.